If your blood sugar numbers are not moving the way they should, despite watching what you eat, taking your medication, and doing everything your doctor has told you to do, I want you to hear this clearly. The problem may not be what you are doing. It may be what nobody has told you to do yet. I have a patient I will call Gerald, early 70s, fasting blood sugar stuck in the 190s, already on metformin, had cut back on sugar, reduced his portions, and his numbers had barely moved in 8 months. Not the frustration of someone who gave up, the frustration of someone who kept going and kept hitting the same wall. What Gerald did not have was a specific, ranked, practical set of tools that work fast, not eventually, fast, within hours to days of using them correctly. That is exactly what I am going to give you today. I am Dr. Raj Patel, 15 years in clinical practice working with adults managing blood sugar, 5 tools ranked by speed of effect, a bonus at the end that moved Gerald's numbers more than anything else on this list. Stay with me through all 5 because that bonus is worth waiting for. Number 5, a post-meal walk. And before you skip past this, most people doing this are doing it at the wrong time and getting a fraction of the benefit. When your muscles contract during a walk, they pull glucose directly out of your bloodstream without needing insulin to do it. That is the critical detail. Insulin resistance means your cells have stopped responding efficiently to insulin signal. But muscle contraction bypasses that signal entirely. It opens a separate door and glucose walks straight through. Here is where timing matters. Your blood sugar peaks 60 to 90 minutes after you start eating. If you wait until after that peak, you are cleaning up after the fact. But if you walk within 30 minutes of finishing your meal, you are blunting the spike as it forms. That is a fundamentally different effect. For seniors, I am not talking about a fast walk or breaking a sweat. 20 to 25 minutes at a comfortable pace produces a clinically meaningful reduction in post-meal glucose. Intensity matters far less than timing. Practical step: put your shoes by the door before you sit down to eat. Not after, before. Remove the decision from the moment when you are full and the couch is right there. Make the walk the obvious next step before the meal even begins. Speed of effect, same meal, same day. Your post-meal number on a walking day versus a sitting day can differ by 20 to 40 points. That is not a small difference. Number 4, apple cider vinegar. And I want to give you the mechanism because understanding why this works is what makes you actually use it consistently. The active compound is acetic acid. It slows gastric emptying, the rate at which food moves from your stomach into your small intestine. When that rate slows, glucose enters your bloodstream as a controlled drip rather than a sudden flood. Your pancreas has more time to respond. Your cells have more time to absorb. Acetic acid also improves glucose uptake directly into muscle cells. Combined, research has measured a reduction in post-meal blood sugar of up to 34% in some studies. For someone whose post-meal number regularly climbs into the 200s, a 34% reduction is the difference between a dangerous spike and a manageable one. This is not about eliminating carbohydrates. It is about managing what those carbohydrates do once they are inside your body. Apple cider vinegar does not change what you eat. It changes how your body processes what you eat. Practical step: 1 tablespoon in 8 ounces of water taken immediately after a higher carbohydrate meal. Not before bed, not on an empty stomach. Immediately after the meal while digestion is just beginning. 2 cautions. If you have acid reflux or GERD, dilute it further or speak to your doctor first. If you have gastroparesis, do not use apple cider vinegar without medical guidance. Further slowing gastric emptying can be counterproductive. Speed of effect within the same meal window. Number 3, and this is the one that surprises people most, not because it is complicated, but because it is so fundamental to how blood sugar works at a cellular level, and yet almost never comes up in a standard appointment. 2 minerals, potassium and magnesium. Potassium first. When glucose enters your bloodstream after a meal, it needs to move into your cells to be stored or used for energy. That movement depends heavily on potassium. Without adequate potassium, glucose struggles to cross into the cell. It stays in the bloodstream. Your body interprets this as insufficient insulin and tells the pancreas to produce more demand, more resistance building over time. A cycle quietly deepening insulin resistance, not from what you eat, not from lack of exercise, but from a mineral deficiency nobody checked for. Now magnesium. The beta cells in your pancreas that produce insulin require magnesium to function. Not optionally, they require it. Research has shown consistently that nearly every person with type 2 diabetes is deficient in magnesium. Their insulin-producing cells are working at a fraction of their potential as a direct result. Here is what makes this especially relevant for seniors. Many common medications prescribed after 60 Is, diuretics for blood pressure, certain heart medications, actively deplete both minerals. Every time that medication flushes excess fluid, it also flushes minerals your blood sugar regulation depends on. This is exactly what I found with Gerald. His magnesium was low, not critically, but low enough to quietly undermine everything else he was doing. His diuretic had been doing its job on his blood pressure for years, while silently draining the minerals his blood sugar management needed. We addressed it, and within a week, his fasting numbers began moving in a way they had not moved in months. For potassium, prioritize food first. Avocado, spinach, sweet potato, white beans, salmon. Do not supplement potassium without speaking to your doctor. High potassium can be dangerous in certain conditions. For magnesium, the form matters. Magnesium glycinate is the most gentle and well-absorbed form for older adults. 300 to 400 milligrams in the evening is what I typically discuss with patients. But if you are on heart or kidney medication, have that conversation with your doctor first. Speed of effect, 3 to 7 days of consistent intake. Number 2, and I want to be deliberate here because this is the most clinically significant natural compound on this list. Berberine activates an enzyme called AMPK, the same pathway that metformin activates. When AMPK switches on, it does 3 things simultaneously. It improves insulin sensitivity at the cellular level. It reduces how much glucose your liver produces and releases between meals. And it improves glucose uptake into muscle cells. 3 pathways, working at the same time, which is why berberine in several head-to-head studies has produced results comparable to metformin in fasting glucose reduction and HbA1c improvement. I am not telling you to replace your medication. I am telling you the research is serious enough to deserve a real conversation with your doctor, not a dismissal, a conversation. Practical guidance. 500 milligrams, taken with a meal, up to 3 times daily. Start with 1 dose per day and increase gradually over 1 to 2 weeks to reduce GI side effects. Cautions. If you are on metformin, berberine adds to the glucose-lowering effect and needs monitoring. If you are on blood thinners, immunosuppressants, or certain heart medications, check for interactions. If you are on insulin or a sulfonylurea, glipizide, glimepiride, glyburide, the combined effect can cause hypoglycemia if your dose is not adjusted. I list these not to discourage you, but because a doctor who gives you the full picture is more useful than one who gives you only what you want to hear. Speed of effect, 1 to 2 weeks of consistent use. What is your current fasting blood sugar number? Just the number, drop it in the comments right now. I read every single one, and those numbers shape every video I make for this channel. If you see a number in the comments that looks like yours, respond to that person. Let them know they are not alone. Number 1, and the bonus are right now. Stay with me. Number 1, the fastest acting tool on this entire list. And before you close this video because you heard the word exercise, what I am about to describe requires no equipment, no gym, and no more than 8 minutes of your time. Resistance intervals, short bursts of muscle contraction with rest periods in between. When your muscles contract against resistance, They create an immediate demand for fuel and pull glucose directly out of your bloodstream through what researchers call GLUT, 4 transporters, a direct glucose entry channel that operates completely independently of insulin. This is the most important sentence in this video for anyone dealing with insulin resistance. Your muscles can lower your blood sugar without insulin, and the harder they contract, the faster they do it. For seniors, this does not mean high-impact jumping or heavy weights. It means controlled resistance against your own body weight. Here are 3 examples requiring nothing except a chair. Chair, sit to stands. Stand up from your chair as slowly as you can control, then sit back down just as slowly. The slowness keeps muscles under continuous tension rather than using momentum. 10 repetitions, rest 60 to 90 seconds, repeat 4 to 5 times. 8 minutes total. Wall sits. Back against a wall. Slide down until your thighs are as close to parallel with the floor as your knees allow. Hold 20 to 30 seconds. Rest. Repeat 4 times. Standing marches with a resistance band. Loop a light band around your thighs and march slowly in place, pressing your knees outward against the band with each step. 2 minutes on, 90 seconds rest. Repeat 3 times. Done within 30 to 45 minutes of a meal, or any time your blood sugar is running high, these produce measurable reductions in circulating glucose within 15 to 20 minutes of finishing. I have had patients check their blood sugar before a session and again 20 minutes after and see drops of 30, 40, even 50 points. Not over a day, within the hour. Caution: if you are on insulin or a sulfonylurea, exercise stacks on top of your medication's glucose-lowering effect. Have a conversation with your doctor about whether your dose needs adjustment before you begin a new resistance routine. Speed of effect: during and within 20 minutes of finishing. Nothing else on this list produces that speed without a prescription. The bonus: the thing that moved Gerald's numbers more than anything else we tried. Time-restricted eating. And before the word fasting makes you close this video, this is not about starving yourself or skipping meals. It is about compressing your eating into a consistent daily window, so your body has a meaningful period overnight where it is not processing incoming food and insulin levels are allowed to fall. When you stop eating, insulin begins to drop. As it falls, your body shifts from storing glucose toward using it. Your liver quiets down. Your cells, no longer flooded with insulin, begin recovering their sensitivity to it. Your body starts drawing on stored glucose as fuel and clearing it from the system in a way no single meal-based intervention can replicate. For most seniors, a 14 to 16-hour overnight fast is both achievable and appropriate. Last meal at 6 p.m., first meal at 8 a.m., 14 hours. Push breakfast to 10 a.m. and you have 16. You are sleeping for most of it. You are not white-knuckling through hunger. You are simply giving your body the overnight space it needs to reset. By the time we introduced this with Gerald, he had already been doing the post-meal walks, the vinegar, and we had addressed his minerals. His numbers had come down from the 190s into the high 150s. Real progress. But it had plateaued. That ceiling felt permanent to him. We added one thing. Last meal by 6:30. Nothing after except water and plain herbal tea. First meal at 9 a.m., 14 and a half hours. No other changes. Within 5 days, his fasting numbers dropped into the 100s and 30s. Within 3 weeks, he was consistently waking up to numbers in the 100s and 10s and 100s and 20s, a range he had not seen in years. He called my office and said, "I do not know what changed, but something changed." What changed was that his body finally had enough consecutive overnight hours without incoming glucose to begin clearing the backlog. Everything else had been managing the daily load. The fasting window gave his system space to actually recover. Start with a 12-hour window if 14 feels like too much. Last meal at 7 p.m., first meal at 7 a.m. Once that is comfortable, extend it gradually. 30 minutes every few days until you find the window that works for your numbers. Water throughout the fasting window. Plain herbal tea is fine. Black coffee in small amounts is generally acceptable. The most important caution in this entire video: if you are on insulin, do not attempt time-restricted eating without direct medical supervision. Fasting while on insulin can cause dangerous hypoglycemia. The same applies to sulfonylureas. These medications are calibrated to your current eating pattern, and changing that pattern requires a corresponding adjustment to your dosing. Please have that conversation before you start. Speed of effect. Fasting numbers begin shifting within 5 to 7 days. The full effect builds over 2 to 4 weeks as insulin sensitivity genuinely begins to recover. 5 tools. A post-meal walk, blunting the glucose spike in real time. Apple cider vinegar, slowing glucose entry and improving cellular uptake. Potassium and magnesium, correcting the mineral foundation blood sugar regulation depends on. Berberine, activating 3 metabolic pathways simultaneously. Low-impact resistance intervals, the fastest tool on this list, pulling glucose out of your bloodstream within minutes. And the bonus, time-restricted eating, the thing that does not just manage your blood sugar meal to meal, but gives your body the overnight space it needs to begin genuinely recovering. Gerald did not transform his numbers with one of these. He built them one addition at a time until the combined effect produced something none of them could have produced alone. You do not have to do all of this tonight. Start with one thing. Put your shoes by the door before your next meal. Walk for 20 minutes afterward. Check your number an hour later. Let your body show you what it is capable of when you give it the right input at the right time. Your numbers are not fixed. Your body is still responding. It just needs you to give it something worth responding to. Drop your fasting blood sugar number in the comments below and tell me which one of these 5 tools you are starting with tonight. I read every single one. This video is for educational purposes only. Always consult your personal physician or healthcare provider before making any changes to your diet, exercise routine, or medications, especially if you have diabetes or any other medical condition. I will see you there.